Welcome back to Motors in Medicine. On today's episode, I'm going to be focusing on the condition known as PTSD, or post-traumatic stress disorder. Now, a little background on that. As of 2019, the last time that the statistics were taken by the World Health Organization, 1 in 8 people nationwide suffer from some form of mental disease or disorder. And included in that are depression, anxiety, PTSD, schizophrenia, those types of things. So it's very, very, very common. Now, PTSD is a condition that it affects not just the emotional, but the physical. And there's a lot of detrimental side effects to having PTSD. Now, I'm going to go over what PTSD is classified as and how it's diagnosed. We'll go over the diagnostic criteria. And then in a prior video, I had discussed some treatment methods, but we'll just touch on those briefly. I just wanted to focus mainly on PTSD itself and how common it is. And the reason being is that since I've been working so much in injury care, and especially as of late, I've been working in personal injury, I see a lot of PTSD in the patients that I see. People who have been in very severe automobile accidents, auto versus pedestrian, attacked by another person or attacked by an animal. And these stressors just create a very unhappy person, but also a scenario in their brain that they are just not functioning very well. So let's get started with what the diagnostic criteria are for PTSD. Now, with any type of PTSD, you have to have some type of inciting incident or stressor, if you will. And this could be in the form of witnessing the accident or horrific event, or you participating as the person that suffered the incident itself. So you can get PTSD from suffering the symptoms directly yourself or suffering the incident yourself, or from witnessing other people. Say, for example, you see somebody get into a horrible accident, or you witness somebody crash their car, or a plane crash, or like, for example, during 9/11, PTSD occurred not just to the people that were in the building, but people watching the building come down and collapse also suffered PTSD. So you've got your stressor. And then the next thing on the list, and these diagnostic criteria are according to the DSM-5. And the DSM-5 is a book that's used by mental health care professionals that are diagnosing things like anxiety, depression, bipolar disorder, things like that. So these are like the diagnostic criteria that were put together to help people figure out, to help providers like myself figure out if people meet these diagnostic criteria, what is the next step? Counseling, treatments, medications, and so forth. So you have your stressor. The next is going to be what the diagnostic criteria calls an intrusion. And that's when something gets into your daily routine, or interferes with your daily routine. Specifically, you have either something that gives you a reminder, like a flashback, or even bad nightmares, that type of thing. You just kind of relive the incident over and over again. And that's the intrusion into your psyche. The next is called avoidance. And that's where you try with all your might to avoid any type of memory or remembering or any reminder of any kind of the incident itself, whether it happened to you or to somebody that you know or that you witnessed. You just try to avoid it altogether, and you're just trying to put it out of your mind. Although that method doesn't work, it is something that we just go through. So avoidance is the next diagnostic criteria. Beyond that, we have negative cognitive or mood changes. And that's where you start having issues with with primary functions in your brain. You just don't think things through. You start doing things that are maybe just a little bit off. You definitely have mood swings. You're easily irritated, things like that. And that happens to just about everybody who suffers from PTSD. The next criteria is basically like an alteration to what your normality is. So you end up having decreased abilities of sleep, decreased social function, interacting with people. You start to avoid people. And this is the one that you, as a person, as an outsider, you would notice these types of things. The altered psychological, the altered normal behavioral patterns that you know as if you know people really well. These are the things that you start to notice as a friend or a family member when they start to change and shift over. Beyond that, to diagnose PTSD, you have to have been suffering from it for at least a month or more. And that's subjective, but most people who are suffering from true PTSD have had these symptoms for at least a month. Most people have them far longer than that, months, possibly even years, depending on what the stressor was. Then you get into like your functional disorders, and that's where you just can't hold down a job. You can't go and stay in school. You can't focus in your classes. You can't be around just normal social situations. Those things start to happen. And then, of course, the last thing to diagnose this properly would be like excluding everything else, meaning that the symptoms that people are suffering are not a result of, say, substance abuse or drugs or any other thing that's not related to the stressor. But basically, you have these things that occur. You witness a really bad event, and it could be a death, it could be an accident, it could happen to you, it could happen to somebody that you know, it could happen to a stranger. It doesn't really matter. During 9/11, for example, the people that witnessed those that were in the building either falling to their death, jumping out windows, or people that were just being crushed, things like that. That's just crazy amount of stressor that affects your psychological processes, and therefore you start to develop an incredible sense of fear and anxiety, and this is what leads into the PTSD. As I had mentioned in a prior video, treating PTSD is something that's a little bit complicated. It's not something that happens quickly. Typically, the approach to treat PTSD, you have to focus on identifying all of these things that are diagnostic, of course, and then trying to figure out how to best tackle one issue at a time. You have to try to, of course, get into some verbal communication where you disclose as much as possible, and you're acting basically in a counseling type of setting. So whenever I see my patients that have been involved in really bad, horrific car accidents or the like, I try to get them in to see a mental professional for counseling, psychiatrist, for example, that can help them kind of talk through some of these issues and work through the steps on trying to kind of get back into some form of normalcy. Beyond that, there's trying to establish a routine, because before this incident occurred, you had a certain routine in your life that you were following. And because of this stress or an incident, you no longer have that routine. So trying to get on some type of routine is crucial for recovering from PTSD. There is, of course, the medication side of things, and medications, in my view, I always try to reserve those for being the very last, just because it's really easy to just get your pen out and sign a prescription for somebody, but I almost wonder if that might lead to other dependencies and other issues. So I try to hold back on medication as much as possible and focus on the counseling, identifying the issue, working through other means, getting a routine established again, And then beyond that, as I discussed in the previous video, one thing that I have been using in my practice for the last few weeks, and I've seen profound results, was with AlphaStim. AlphaStim is, as I discussed in the previous video, is basically it's an electronic machine that changes the waveform in your brain from delta over to alpha. And during that period of time that you wear it, and while you're in alpha wave, you tend to be in a more relaxed, in a more decreased state of stress, anxiety, and these mental positions that you're placed in under AlphaStim help you to feel less stress, less PTSD, less anxiety. It helps you to deal with these things in a more realistic manner. Now, tackling PTSD needs to be done with a complete team of professionals, and family members included, loved ones, support group, friends. Everybody has to be involved in helping somebody get through PTSD, realizing that this is going to be a multi-step process and it's going to take time. So I really just wanted to bring to light that, like most other mental disorders, PTSD is extremely common. And beyond that, treating it, identifying it, have to be done expeditiously, or people will fall into a very dark place that is just not commensurate with existing for a very long period of time. That's just, we have to be identifying these stressors and figuring out a way to manage and help people get back into their daily routine that helps them get past these stressors and get past these incidents that have occurred and try to develop some sense of normalcy. So, as I discussed, hopefully this information is bringing a little bit of awareness to you guys regarding PTSD, the importance of recognizing the signs, if it happened to you personally or people that you know, or just to a total stranger for that matter. Understanding that it is a process to get through, realizing that there's multifaceted treatments involved, from medications to counseling to AlphaStim to photobiomodulation, you name it. There's just a number of different treatments that are helping people get back into that normalcy that they knew before the stressor or the incident that occurred causing the PTSD. If you found this information helpful, please give this video a thumbs up. And if you haven't subscribed to the channel, do so. I try to bring content that's pertinent to most people, that applies to people who just live normal, ordinary lives. And of course, this is on the medical side. On the motors side of my channel, I try to bring content that's just kind of fun and a little bit informational, a little bit instructional. But until next time, I'm going to be getting back into the cars. I'm thinking that based on the time frame, we're going to be discussing the Bronco again, and we'll get into that video later. So until that time, this is Motors and Medicine signing off. I really appreciate all your support. Thank you very much for watching.